This medicine is used with another drug, a somatostatin analog such as octreotide, to treat diarrhea caused by carcinoid syndrome. Telotristat helps to decrease the frequency of bowel movements. When taking Xermelo 250 mg tablet, it's important to follow your doctor's instructions and take it with food. Usually, you will need to take this medication 3 times a day. If you are also using short-acting octreotide, make sure to take Xermelo at least 30 minutes before using octreotide, as octreotide may decrease the amount of Xermelo in your body. It's important to use this medication regularly in order to get the most benefit from it. Try to take it at the same times each day to help you remember. If your condition does not improve or if it gets worse, be sure to inform your doctor. Some common side effects of Xermelo 250 mg tablet may include headache, decreased appetite, gas, or constipation. If these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any severe abdominal pain, severe constipation, or swelling of the hands, ankles, or feet. While it is rare, a very serious allergic reaction to this drug may occur. Seek immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching, swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects. If you notice any other effects not listed here, consult your doctor or pharmacist. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Before starting Xermelo, make sure to inform your healthcare provider if you have any allergies or if you are allergic to any of the ingredients in the medication. It is also important to discuss your medical history, particularly if you have liver problems. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications you are currently using. If you are pregnant, this medication should only be used if absolutely necessary, so it's important to discuss the potential risks and benefits with your doctor. It is not known whether Xermelo passes into breast milk, so be sure to consult your doctor before breastfeeding. Remember to always follow your doctor's instructions and guidelines when taking Xermelo. It's important to be aware of potential drug interactions with Xermelo. This medication can speed up the removal of other medications from your body, which may affect how they work. Examples of affected drugs include asunaprevir, daridorexant, elacestrant, midazolam, ombitasvir/paridoprevir/ritonavir, quizartinib, among others. Additionally, Xermelo may decrease the effectiveness of hormonal birth control such as pills, patch, or ring, which could cause pregnancy. It's important to discuss with your doctor or pharmacist if you should use reliable backup birth control methods while using this medication. Also, be sure to tell your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working well. Remember to keep a list of all the products you use and share it with your doctor and pharmacist, and do not start, stop, or change the dosage of any medicines without your doctor's approval. If you or someone you know has taken too much Xermelo and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or your local poison control center at 1-800-222-1222. For Canadian residents, you can call a provincial poison control center for assistance. This medication is for your use only. Do not share it with others. If you forget to take a dose, just wait until it's time for your next dose. Don't take extra to make up for the missed dose. You should store Xermelo 250 mg tablet Antidiarrheal, Tryptophan hydroxylase inhibitor at room temperature, away from light and moisture. It's important to keep it in a safe place away from children and pets. When it's expired or you no longer need it, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.